Albuminuria. The presence of albumin, a type of protein in the urine, often indicating kidney damage or disease. Normally, the kidneys prevent proteins from leaking into the urine, so albuminuria is a sign of impaired kidney function. Anuria, a condition characterized by the inability to produce urine or a very low urine output. It often indicates severe kidney dysfunction or failure, which may be caused by kidney disease, dehydration, or urinary obstruction. Adrenal refers to the adrenal glands located above the kidneys, which produce hormones like adrenaline, cortisol, and aldosterone. These hormones regulate stress responses, metabolism, immune function, and blood pressure, playing a vital role in maintaining homeostasis. Cystoscopy, a procedure in which a cystoscope, a thin tube with a light and camera, is inserted through the urethra into the bladder. It allows doctors to visually examine the bladder, diagnose conditions like infections, and sometimes remove bladder stones or tumors. Diabetes, a chronic condition where the body either doesn't produce enough insulin, type 1, or cannot properly use the insulin it produces, type 2. It leads to high blood sugar levels, increasing the risk of complications such as nerve and kidney damage. Dialysis, a medical treatment for kidney failure, where a machine filters waste, excess fluids, and toxins from the blood when the kidneys can no longer do so. There are two types: hemodialysis, filters blood outside the body, and peritoneal dialysis, filters within the body. Dysuria, painful or difficult urination, often accompanied by a burning sensation. It is commonly caused by urinary tract infections, UTIs, bladder infections, or urethritis. It can also be associated with kidney stones or sexually transmitted infections, STIs. Filtration, the process by which the kidneys filter blood to remove waste products, excess substances, and toxins. The filtration occurs in the glomerulus, a network of tiny blood vessels in the kidneys, and is vital for maintaining fluid and electrolyte balance. Goiter, an enlargement of the thyroid gland, often caused by an iodine deficiency or thyroid disease. The thyroid gland, located in the neck, produces hormones that regulate metabolism. A goiter may indicate hyperthyroidism, hypothyroidism, or thyroid cancer. Glucose, a simple sugar that serves as the body's main energy source. It is absorbed into the bloodstream from food. Insulin helps regulate blood glucose levels, and abnormal levels can indicate conditions like diabetes or metabolic syndrome. Hematuria, the presence of blood in the urine, which can be microscopic, detected only by a microscope, or gross, visible to the naked eye. Hematuria can result from infections, kidney stones, trauma, or underlying kidney or bladder conditions. Homeostasis, the process by which the body maintains a stable internal environment despite external changes. It involves regulating factors like body temperature, blood pressure, fluid balance, and blood sugar levels. The kidneys, liver, and other organs contribute to homeostasis. Lithotripsy, a medical procedure used to break up kidney stones or bladder stones into smaller fragments using shock waves or lasers. The fragments can then pass more easily through the urinary tract, relieving pain and preventing complications like obstruction. Nephrolithiasis, the formation of kidney stones, which are hard deposits of minerals and salts that form inside the kidneys. Nephrolithiasis can cause severe pain, hematuria, blood in the urine, and urinary obstruction. Risk factors include dehydration, diet, and genetic predisposition. Pancreas, a gland located behind the stomach that plays a key role in digestion and regulating blood sugar. It produces digestive enzymes and hormones such as insulin, which helps control blood glucose levels, and glucagon, which raises blood sugar when needed. Parathyroid, 4 small glands located behind the thyroid gland that produce parathyroid hormone, PTH. PTH regulates calcium and phosphate balance in the body by controlling the release of calcium from bones and the absorption of calcium in the intestines. Pituitary, a small pea-shaped gland located at the base of the brain. It produces and secretes hormones that regulate growth, metabolism, reproduction, and other endocrine functions. Known as the master gland, it controls other endocrine glands like the thyroid and adrenal glands. Thyroid, a butterfly-shaped gland located in the neck that produces hormones including thyroxine, which regulate metabolism, growth, and energy use. Thyroid disorders such as hypothyroidism and hyperthyroidism can affect metabolic functions and lead to various health issues. Urethra, the tube that carries urine from the bladder to the outside of the body during urination. In males, it also serves as the passageway for semen during ejaculation. The urethra is surrounded by muscles that help control urination. Cushing refers to Cushing syndrome, a condition caused by prolonged exposure to high levels of cortisol, a hormone produced by the adrenal glands. Symptoms include obesity, high blood pressure, muscle weakness, and purple stretch marks. It can be caused by adrenal tumors or steroid use. Radioactive iodine, a form of iodine used in medical treatment, particularly for thyroid disorders like hyperthyroidism and thyroid cancer. It is ingested or injected and absorbed by the thyroid, where it helps destroy overactive thyroid cells or tumors. Urinary catheterization, a medical procedure where a catheter, a thin tube, is inserted into the urethra to drain urine from the bladder. It is used when a person is unable to urinate due to obstruction, surgery, or urinary retention. Cushing syndrome, a condition caused by prolonged exposure to high cortisol levels, often due to corticosteroid use or a tumor in the adrenal glands or pituitary gland. Symptoms include weight gain, high blood pressure, and changes in skin appearance. Graves' disease, an autoimmune disorder that causes hyperthyroidism, overactive thyroid. The immune system attacks the thyroid gland, leading to excessive hormone production. Symptoms include weight loss, rapid heartbeat, bulging eyes, and heat intolerance. Cub X-ray, a type of X-ray imaging used to examine the kidneys, ureters, and bladder. It helps detect abnormalities such as kidney stones, bladder issues, or urinary tract infections, and is often used as an initial diagnostic tool.